Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Welcome. This is Your Family's Health. This is Joan Buckley from the Department of Nursing here at Nassau Community College. Today we're going to be talking and learning a little bit about orthopedics. We're going to learn what is an orthopedist, and we're also going to look at the relationship of both of these terms and sports injuries. So we have an expert with us. Our guest is Dr. Adam Bitterman. He's the chairman of the Department of Orthopedic Surgery over at Huntington Hospital, part of the Northwell Health system. Dr. Bitterman is also an assistant professor at the Zucker School of Medicine at Hofstra, Northwell. So Dr. Bitterman, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Thank you so much for having me. I appreciate the invitation.
No problem. You know, it's not that we don't know anything about orthopedics or what an orthopedist does, but we want you to tell us a little bit about you. What is orthopedics, and why did you pick orthopedics?
Absolutely. Orthopedics in general is a specialty of medicine involving the musculoskeletal system. And that can be the neck, that can be the back, that can be the extremities, whether that be the upper extremities, the lower extremities. That can even involve trauma cases surrounding the pelvis. And it is any bone or muscular injury that requires treatment. And it's not necessarily a surgical treatment every time. In fact, most orthopedic surgeons are able and willing to treat things without surgery. And so that is the definition of orthopedic surgery, a musculoskeletal caring team with the focus of getting people back to regaining their function prior to their injury.
You know, you said that it doesn't always involve surgery, yet you are an orthopedist, and I'm sure you do surgery. So can you tell us a little bit about why did you choose orthopedics? Because we have a lot of, young listening audience folks that might really be interested, because that kind of a description of the job is pretty intense. It sounds like a lot of pain. So why did you pick it? Your patients have to be uncomfortable when they come to you.
There's no doubt about it that the specialty that I'm in, my daily physical exams that I perform do inflict pain. And I try and tailor the exam to cause as little pain or discomfort as possible. But I always coach the patient and tell them that what I'm about to do in order to find the solution to your problem may not be the most comfortable. That being said, it is significantly rewarding to be able to find a problem, fix a problem, and get someone back on their feet, literally and figuratively, or get them back out on the competition field that they were participating in prior to this injury. But overall, it's an intense field. It requires 4 years of medical school, 5 years of residency training, and plus or minus 1 to 2 years of fellowship training, which comes after the residency training graduation.
So what in your past? So are you an athlete?
I am.
I had
or I like to consider myself one.
There are a lot of athletes like that. But so knowing this and knowing that sports injuries can be life-changing, how would you prepare a student or someone for athletics? Like, is there conditioning that could prevent some of these injuries that you see more often? Is there a way to really prevent them, to prepare a young athlete so that they are less at risk to have these problems?
So traditionally, I just want to jump back and complete an answer from before. Traditionally, athletics are sort of hand in hand with orthopedics, but not every orthopedic surgeon is interested or follows sports the way you may think. The traditional approach was a kind of like a jock mentality, and that is not always the case at this point. But I was what I consider to be an athlete back in the day. I injured things, I broke things, I saw my own orthopedist, and took a liking to it. And as I went through my training, I figured that was the only specialty for me that I could tolerate, and went full throttle. And here we are. For someone who is on the fence, for someone who is not sure, of course, I'm going to sit here and plug the specialty that I think is the greatest out there. But it's not one that comes easily. It is one that requires a lot of work. It is one that requires a lot of dedication. As far as the patients that I treat, certainly a conditioning and strengthening program, core strengthening, and appropriate stretching certainly can help mitigate the injuries that I see. However, certain collision sports are extremely high risk for injury, whether that be broken bones, torn tendons, torn ligaments. In fact, most recently there was a very high-profile athlete who did tear his Achilles tendon. And so these things happen, whether you're 18 years old or approaching 40.
So if an athlete, a young athlete or an older athlete did have an injury like this, what would be like the first thing? Who would refer them to you? It's not always like an emergency where the ambulance brings them to, and tells them to the hospital, then they refer them. But what makes a person come to you specifically? Where does the referral come from?
The referrals tend to come from primary care doctors. The referrals can come from school nurses. The referrals can come from school athletic trainers. In the sports space, which again is only a percentage of the population that I treat, they usually come from someone within the sports medical team, an athletic trainer, a coach, an assistant coach, a family member of a coach who was aware of an injury. So that's how they usually get linked in. And then the second cohort does come in through an ambulance. After a fall, after a trauma, after a car accident. And so you're right, they do come in multiple groupings.
What could someone expect the first initial exam to be like, say for a lower extremity, a leg injury or something like that? Like what would, when they meet you, how does the whole visit go? Do you ask them a lot of questions or do you go right to the bone? I mean, I would think that if someone's uncomfortable, you go right to what the problem is. But I'm sure there's more to it than that. You're not just the bone. There
definitely is. No, there definitely is. While we are very thick-headed and bone surgeons, we want to get the whole picture. And obviously a thorough history and physical exam 101 is critical because there are certain issues that can arise and lead to musculoskeletal injury from a medical standpoint. If there are underlying antibiotics being used, if there's a history of steroid utilization, then soft tissue injury is a major possibility. So understanding who the patient is, what they do for a living, is how I approach this first. Once I get a grasp on what they do and how they did this injury or how they've come to me with their complaints, I then dive into more details on the specific symptoms that they're experiencing. What have they tried? Are they feeling better with an anti-inflammatory? Have they utilized a specific shoe or a brace? Is icing helping? Because all of that gives me an insight into what they're looking for. And then I try to understand the goals of the visit. Not everybody is there for a cortisone injection. Not everybody comes to me wanting an MRI. Some people want reassurance. And so that's part two. And then I kind of dive right in, as I said, with my disclaimer from earlier saying that it's going to cause some discomfort, but this is an attempt and a measure to get you to that next level where you are feeling better. And it will involve an examination of some tender points, whether that be a broken bone, whether that be a sprained ligament or a torn tendon. And of course, certain people come to me with protective splints on already. And so having to expose the injured area is also part of it.
That's really interesting. We're going to take a quick break. I just wanted to let everyone know you're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Joan Buckley from the nursing department here at Nassau Community College, and we are speaking to Dr. Adam Bitterman, the chairman of the Department of Orthopedic Surgery at Huntington Hospital. So now we were talking about, before the break, some things and the process. So they come in, they meet you, you find out a lot about them besides the bone or the muscle pain or whatever. You really do seem to delve into who the person is and how this is affecting their lifestyle. With an injury that's not affecting their immediate health, I would say, like something like it's a pain that they've had for a long period of time. What would be the first treatment, do you think, besides the anti-inflammatories? Do you often use like physical therapy and some sorts of exercises to kind of see where that goes? Or are there other things that we would expect to find out in that office?
Absolutely. Physical therapy is a great first line treatment. It can even be a second line, third line, and it's frequently associated in the post-operative world. Other items would be devices that you can place on the patient. So a person may leave the office wearing a brace. The person may leave the office with crutches, offloading the injured area. And then this is all focusing mainly on the lower extremity, but certainly upper extremity would be immobilization with a sling. But even a cast to limit activity and mobilization is another means of helping the person feel better.
Now, how young are your patients? What is the age range?
I tend to treat adults mainly, so 16, 17, 18 and up, physiologic adults, not necessarily age-wise, but then I can go down to the 12, 13 range, but I do work hand in hand with my pediatric orthopedic colleagues at Cohen's.
That's really good, very good, because I see so many little guys out there on the little football, things on, and they're playing soccer. Forget soccer's everywhere, not so much now, but in the spring. So now is the football season. How do the role of the parent now, because you do deal with teenagers and college students and, young adults, how do you deal with the family? Is the family often a big part of your discussion and who you discuss with?
Absolutely. In the adult population, I still see parents involved. And so it's a full transparency spectrum, if you will, where I have to verify that everything that I'm about to say is kosher to be said in front of mom or dad or aunt or uncle. Obviously, if you're dealing with a minor or a teenager, then certainly they must be involved. But I also want to make sure that all of the questions that they have are being answered. And it can be a situation where the child is just deferring to his or her mom or dad or grandparent. And I kind of put them on the spot and I say, no, I know that you may not want to make a decision, but I want you to help me know that you're understanding everything. And I want you to ask the question. And certain times they are very inquisitive and they'll ask a question that kind of blows me out of the water. And then there are other times where they just defer to the adult in the room. But I always have a team approach.
That's excellent. And these young, I'm only looking at the young part because we're talking sports, and there are older adults that are still involved in sports, of course, and there are those that just do it on the weekend and holidays. But in that age group, when there is something that's going to require time to heal, how do you approach it? Being an athlete yourself at one point in your life, how do you break it to them that this is maybe the end of their athletic career, or don't even go there when it first happens? Like, how do you deal with really serious stuff that may affect them?
It's a slippery slope. I am the brunt of bad looks quite frequently, especially this time of year, because a lot of the schools are going back to full fall sports. And over the past few weeks, they've been doing 2-a-day practices or practicing 6 days a week, where these kids were just coming off of camp. And so they're literally going 0 to 60 without much of a warm-up period. And I think that's just the nature of the beast. And unfortunately, with that can come overuse activities. And so in order to recover, frequently there is a downtime period that needs to be respected. You can't force a return to play program without allowing inflammation to calm down and strength to be rebuilt. And so frequently it's 2 weeks, and then we reassess. If it's a fracture, I kind of give them the bad news right up front and say it could be 4 weeks, maybe even 6 weeks. It's rare for a kid to have an injury that then prevents them from participating in sports long term. I would say in the older athletic population, or even the young older population, I have to be careful because I don't know exactly who's going to be listening.
Absolutely.
But patients will tear their Achilles and they'll say to me, I'm never playing pickleball ever again.
I know. Pickleball, that's the best one now, pickleball.
It is taking over the offices by storm.
Wow. I have to tell you, I tried tennis a while ago, probably 10 years ago or something, and we were learning how to run backwards. And you're absolutely right. It needs to take its time. It's hard. It's not hard. It's hard to condition to the point where our young adults are out there playing sports and stuff. And then they do rush it, but the kids are so excited. I mean, I think when you see your patients and they've recovered, what are some of the comments that they make to you?
Thank you. I've had patients jump and give me hugs.
Yeah.
Patients are sort of shocked at how quickly, in certain instances, they're able to return. They are extremely grateful. I think there's nothing like an extremely grateful orthopedic patient who has the ability to regain their athletic prowess or their ability to return to play pickleball, to play sports, to do what it is that they love to do.
What if you had to give them, say we have an injury, the kid is so excited, you say, okay, you can return to football, right? What are some tips that you give them? Is there a thing that you say to them, maybe 1 to 5, that you want them to really remember so that they don't have this happen again?
I want them to remember the importance of a conditioning program. They will always need to stretch, even when they are not feeling pain. It's important to maintain proper conditioning. It's important to maintain proper strength training. It's important to maintain proper sports-specific training, because when you lose the technique that has given you such success, that's when you get lackadaisical, and ultimately you then become you're building compensatory training mechanisms that can lead to overuse in certain areas, putting you at risk.
And then do they have some comments? Like, do they ever say, oh, no, I can't do that. Don't be silly. And then they're listening, but are you ever concerned that you have a kid that's tough and he's not going to follow your advice? Absolutely.
It's rare that listen, there's the overzealous type that you have to worry about because they are going to potentially not follow your recommendations, and you'll see them back and you kind of warn them. And then there are those that are overly cautious, and sometimes that's a good thing. Sometimes that's a bad thing, because if someone is the cautious type, I don't have to worry about them just running off and doing their own thing. Right. They're going to follow the instructions.
That's so funny. Like my grandson says to me the other day, he says, I need to strengthen my bones. He's 16, so he likes to run. So he goes, I need to strengthen my bones. What should I do? So I'm very cautious. I'm very conservative. I said, oh, you should walk. He goes, are you kidding? He goes, so like from someone like you, they probably see you as themselves almost. They probably picture you as an athlete. Do you have an office that is sports oriented? Like, is it kind of like really conducive to these youngins that come in and with injuries related to things that they really like?
Absolutely. Yeah, we have easy access into our office. We have photos on the wall that are highlighting various sports, not necessarily the four main sports, baseball, basketball, football, hockey, but we have pictures of water sports and skiers and things like that.
And pickleball, maybe.
Exactly.
Championship. So you're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. This is Joan Buckley from the nursing department here at Nassau Community College. And today you are learning about orthopedics, and you're learning about it from an expert, Dr. Adam Bitterman. He's the chairman of the Department of Orthopedic Surgery at Huntington Hospital. But if you've been listening, you know that it's really not all about surgery. It's about healing. So now that we got that little breakout, how about the older population that doesn't realize limitations sometimes? Do you ever, those probably would be the ones coming in from an emergency room, I would think. But yep. I have a lot of, friends that have aches and pains and on my back and my shoulder and things like that. But what's the difference when you approach an older person? Is there things you have to ask them to really find out what is going on? Like, it can't be just aging. It can't be just getting old.
Right. So the first thing I want to do is establish an expectation. If you are greater than 50 years old, greater than 60 years old, we need to establish the ground rules of where do you want to go with this, right? I may not be able to get you 100%. There may be damage done from chronic this, chronic that, wear and tear. And to your point, Joan, there certainly is an age related component that can lead to an inability to get back to 100%. Unfortunately, with age comes other medical illnesses that can wear somebody down. Being on medicines for cholesterol may have an impact on your muscular well-being. Having osteoporosis certainly puts you at risk for various fractures. And so I establish where they want to be, how they want to get there. And then I really try and dig into how it happened and what was the cause.
Yeah, I know pickleball is something that's out there. I haven't gotten there yet myself, but I hear about it all the time. Everybody's on a pickleball team. And with my tennis experience of running backwards as a skill you needed to acquire, I have limited my sports activities for the most part. But I do walk. And sometimes it's the very slightest thing that people don't expect. So do you have anybody in the office with you that works with you and the patient to kind of help them sometimes understand maybe the treatments, maybe even insurance is an issue, especially like you talked about different, medical apparatuses, so say braces or, things like that may be quite costly. Is there anybody in the office that kind of helps you out? Is your office, it's not just orthopedics, you have a team, right? You mentioned that in the very beginning that you're a team, not sports team, you're a team. Yeah.
I'm very fortunate to have a large team, or what I consider a large team, but most importantly, an excellent team. And I wouldn't be able to do what I do successfully without them. And that ranges from my front end clerical staff to my clinical team that is literally walking with me from room to room and probably can give responses better than I can sometimes because they've heard me say the various responses in relation to certain ailments more frequently than others. And so I have a physician assistant who is with me. I have an athletic trainer who is with me. And so between those two, they serve the role of being a physician extender and also answering questions and handling issues that come up if and when I'm in the operating room or not in the office. So the office is constantly functioning from a clinical standpoint, even if I'm not there. In addition, my back-end administrative staff handles some of my insurance issues and logistics issues with scheduling. And then I have a whole administrative team to handle the work with regards to hospital administration. As far as bracing and understanding the mechanics of that, I work closely with an orthotist in the office, and then I also have collaborations with orthotists outside for patients who are traveling from outside the area.
It sounds like people don't have to be, sometimes experiences in the past, kind of, people hesitate going into a specialist, and you are a specialist. You really are. And it sounds like you have everything right there. So you have x-rays, all of those kind of things. Is there anything that you find that people find very intimidating about your office, that you find like you really have to, get them into a good spot so that they hear you?
I always worry about whether patients have a white coat syndrome.
Yeah.
Sometimes I do. I don't wear a white coat. I'll wear more formal clothing. As you can see right now, I'm wearing scrubs. But I try to lower the tension or lower the temperature in the room with regards to apprehension or nerves. And just by having that conversation, introducing myself, introducing the team members, and making sure that all of their questions are answered, because it's not a one-way street. It's not just my way or the highway. I like to incorporate everybody into the decision making. And so getting them on the same page as me is very important. It
sounds like that you have a really good understanding of where people come from when they are not 100%, right? And it happens because they're doing something that they really enjoy. So I want to thank you, Dr. Adam Bitterman, for being here today on our radio station. That you are still the chairman of the Department of Orthopedic Surgery at Huntington Hospital, and you are part of the Northwell system. We hope you stay healthy, and we wish you continued success in your work. If you have anything that you want to leave with the listening audience, any kind of words of wisdom or contact or a website or anything, you can do that and would be thrilled.
Sure. Well, I want to thank you for having me. Certainly, this was a great opportunity. Feel free to reach out to me via email, abitterman@northwell.edu, or on my Twitter page at Dr. Adam Bitterman, at Dr. Adam Bitterman, all one word. And certainly understand that medicine and orthopedics is a multidisciplinary approach, and it's an opportunity to really dig into someone, not necessarily literally, but understand where they're coming from and try to fix their ailment in order to then release them back to doing the things that they do. And there's nothing that gives me more pleasure than seeing that on a daily basis. So thank you.
Thank you. This is Joan Buckley from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.